19. Let's take a listen.
1,363 in Vancouver Island Health Authority, 1,576 in the Interior Health Authority, and 431 active cases in the Northern Health Authority, for a total of 16,014 active cases who have been tested across the province. One of the other things, of course, that we have been watching carefully is our hospitalization rates for people with COVID, and that is at 193 people hospitalized with COVID-19 today, 66 of whom are in critical care or ICU. And since December 24th, we've had an additional 5 people who have died in British Columbia from COVID-19, bringing the total number of deaths from COVID-19 to 2,419. And as always, our condolences and our thoughts go out to all of those who have lost loved ones during this pandemic. So a complete reporting of the confirmed data will be in the statement, as I said, later today. As we talked about prior to the holiday long weekend here, Omicron has left us with more questions than answers, but it also is different, and it is spreading through our communities in a way that is different from other variants that we've seen over the past 2 years. People are getting infected with a much smaller dose of the virus and much more quickly. And they are passing it on to others, often before they realize that that they're able to transmit it. The rate of transmission has impacted a number of different parts of our system that we've had in place, including the effectiveness of contact tracing. The incubation period is fast, and we've now seen that piece of the puzzle come together, both here in BC from the data we have, but also what we're seeing across the country and in other countries globally. The incubation period is now down to a median of about 3 days, from an average of about 6 days with previous variants even as late as a month ago. Which means by the time you develop symptoms and get tested, get that result back, you will likely have exposed others and passed it on to some of them. And as we've seen before, it spreads to the people that we are closest with, the people we live with, the people we socialize with, our family, our friends, our social connections. As a result, we all need to be paying more attention. We talked about this before going into the weekend. Close attention to 2 things: how we are feeling and who we will be spending time with, to make sure that we're not putting people at risk. The puzzle is coming together around Omicron. We are learning more about how fast it spreads, how infectious it is, and it is very clear that it is increasingly transmissible with this shorter incubation period that now is more and more defined. We know as well that you're 10 times more likely to be reinfected if you have been infected before and are not yet vaccinated. And we know that Omicron is causing more breakthrough infections in people who have been vaccinated. But some of the things that we are learning is that particularly people who have 2 doses of vaccine on board, who have been fully vaccinated, regardless of how long ago that was, are much more likely to have milder illness or asymptomatic illness if they do get infected. But given this rate of transmission, if you have any symptoms of COVID-19, you really must assume that you have the virus and take measures to avoid passing it on to others. That means making sure that you're wearing masks in appropriate places, that you stay away from people who may have increased risk, and that if you are not fully vaccinated as well, you are more likely to have more severe illness. The best thing we can do is make sure that we're staying away from others if we are sick ourselves, to rest, drink plenty of fluids, and get medical help if our symptoms worsen. If you're having difficulty breathing, having chest pain, having difficulty drinking or eating, or your self-care is not helping you manage, then contact 811, or if you need to, make sure that you can seek immediate care, and call 911 if you need to. There is additional details about self-management on the Bccdc website that can help you understand the things that can help. If you are a close contact of somebody with COVID-19, you do not need to self-isolate if you're fully vaccinated, but you do need to monitor for symptoms for 14 days, and you need to pay attention because you may be incubating it yourself, and you need to be extra cautious about wearing masks when you're around others and delaying gatherings and visits, particularly to people who are vulnerable. As many people have experienced, our testing centers are now at their maximum capacity, and we have been doing a lot of testing over this past few days, despite things like the weather and dealing with the issues that we've had with some of our testing centers. Our Bccdc symptom checker is a good tool to use if you're unsure about whether you need to get a test. The PCR tests, the more accurate PCR tests, are being used, and we're triaging those to make sure they're available for those who are highest risk, so people who have a high risk of having more severe illness, or for people who need to know whether they have COVID to be able to safely return to work, and particularly making sure that they are available to support our healthcare workers and emergency responders and others. Rapid testing that we have available in the province is now being used across the province to supplement at our testing centres for those who are at lower risk of having severe disease, but people with symptoms where it can help understand if they have COVID or not. If you are a healthcare worker, please do go and get tested and connect with your employment right away. The encouraging trend that we are seeing around the world is that for most people who are fully vaccinated, illness continues to be mild. And for many people, that means if you have mild illness, you can self-manage at home and you don't need a test. Booster doses are also providing added protection to those who are at highest risk, which is why we're continuing to follow the approach of 6 months based on interval from your dose 2 and age being the #1 risk factor. I will say as well that we are continuing our surveillance reporting, the numbers I reported today, which are based primarily on our PCR testing. And that is something that has been consistent. We know that every day the case numbers have a lot to do with how many people are tested where and the capacity at our laboratory. But surveillance is looking at trends over time, and that is the other important things that we look at. So the 7-day rolling average helps us understand trends over time. As well, we have other surveillance streams that augment and support our testing. We look at things like the rate of testing in different communities in different parts of the province and by age. We look at the percent positive in our testing in the different places. We now have an online reporting tool for rapid testing, and that will give us a sense of how many people are reporting that their rapid test was positive. That's just another piece that helps us put together the picture of how this virus is moving through our community in this wave. As a result of the widespread transmission of Omicron, we are seeing higher levels of absenteeism as people become sick, with people needing to stay away from work. And we know that schools reflect what is happening in our communities, and this is affecting our healthcare system as well as other aspects of our society. With this in mind, I have directed the Ministry of Education through an order to take a phased restart for our K-12 schools over the coming weeks. All schools will open on either January 3rd or 4th as planned for children of essential workers and those with special needs, with full return to classes for all students on January 10th. This will give us time to add additional protocols to reduce crowding and stagger times for recesses, those things that we did early on that we know can help reduce the potential for transmission within the settings. As well, school administrators will use this phased approach to address things like making sure we can continue to safely have classes, to address absenteeism and program continuity. We'll also be working very closely with public health in our schools to adjust our testing strategy and to modify our public health notification and working with the schools to make sure that we can put in place measures that help us understand how Omicron is affecting the schools as well. So these revised protocols for notification of staff and student illness and absenteeism, given the spread in the community and the changes to contact tracing. And Minister Whitehead, who's here, will address these details in a few minutes. Whiteside, I'm sorry. So we are learning more. Every day, more of these pieces about Omicron come together. What we don't yet know for sure is how severe this illness will be as more and more people are infected, and how that will impact our healthcare system. We do know, and what we're seeing across the globe and here in BC, is that vaccines make a huge difference. Vaccines work. They may not stop all transmission, but our vaccine effectiveness at preventing severe illness is still very high, and we see that with data from the Bccdc. We've seen that in places across the country, where even older people who are testing positive are not ending up in hospital. And that is the good news right now. But we are not yet at that place where we can say that for sure, and we need to continue to monitor, and that's why we're taking some of these measures today. What we have done collectively has bought us time. It helps us understand more, to ramp up our vaccination, our booster program, to modify our testing so that we know we have the strategies in place that are needed. What we need to know right now is, this week we are seeing that hospitalizations in critical care are holding steady, but we still are having impacts, and uncertainty is still a challenge for us, but we will know more in a week. We are once again in a new phase of our pandemic, and we must continue to evolve and adapt our approach. That's why we're continuing to act to protect our healthcare system, our schools, our communities, and all of us. Despite all of our best efforts, we are not going to prevent this wave, but we do all need to continue to do our part to make sure that we're mitigating it as best we can. This means using all of our layers of protection are even more important now. And paying attention to how we are feeling and who we are spending time with. And we know that people will become ill with this new infectious strain despite all we are doing. And we need to support them. This is just what happens when you have a highly infectious respiratory virus. We need to offer compassion without judgment. And I know it's discouraging sometimes to think that despite everything we're doing, we are going to be exposed to it. We are seeing it move very quickly through our communities. But we do have control. We have control about the things that we can do for ourselves, to protect ourselves and our family, and to support our family. Things that we can do, including upping our mask game, making sure we have a good quality 3-layer mask, or using surgical masks or KN95s in those certain situations where we can't avoid indoor crowded settings. Getting vaccinated, we know that that is what is protecting us the most right now, whether it's your first dose, your second dose, or when you're invited for your booster dose. Give people the space they need. That is an important part of all of the different layers that we have. Keeping those barriers that we have in place, being respectful when you go into a grocery store or the drugstore, wearing your mask, giving people space. Those are things that we do to support each other right now. Avoiding crowds, and particularly if you are concerned at all, if anybody in your social circle has COVID, if you're feeling unwell yourself, please do not go to visit your loved ones in long-term care. Do not go to visit people who may be at greater risk from this strain of the virus as well. As we look to the end of 2021 and the start of a new year, we need to give each other a booster shot of kindness once again and make sure that we get through this together.